Hi, Professor Marshall. My name is Lauren, and I am going to work on trach suctioning and trach care today. First, I will perform hand hygiene when I'm going into the patient's room. I've already assessed the chart to see if he is due for trach care. And then I will go in and assess the room and make sure I have all my emergency supplies here. I will make sure I have all my trach supplies, which I do back here. I'm going to verify with the patient their name and date of birth and explain to them the procedure. I will also tell the patient if you feel any pain or you want me to stop, just raise your right arm and I will stop the procedure at any time so that they feel comfortable. Initially, I'm going to check for some lung sounds to see how their lungs are. I'll assess their respiratory rate and their CO2. Okay, so it seems like we're due for some trach care, so I'll get started. I will put on clean gloves initially. And I will check the oxygen level for the ambo bag and making sure that that's up to 15. I will check that the suctioning is between 100 and 150, probably around 125 or 120. And then I will assess the suction that there is good adequate suction for when I start the procedure on the patient. I will open up my suction catheter. I will open up my suction catheter. And before I start the procedure, I will place the chucks on the patient so that in case there's any mucus or anything that it doesn't get onto the patient's chest. I will also don face shield. I have glasses, so I'm going to use those as my face shield, but I will don this shortly to make sure that I don't get anything in my mouth. I'm going to remove my gloves, perform hand hygiene, and I will put on my mask. I have saline that I will use. What is this? These are not. Is this my suctioning catheter? Okay, so I will remove the box from the inside and I will fill this with saline. And I will don sterile gloves. Where these sterile gloves came from, but they're not very good. Okay, now that I have my sterile gloves on, I will be working with a sterile hand and a clean hand. I will remove my catheter tip, my suction catheter tip with my sterile hand and wrap it up into the sterile hand. And then my clean hand will be with the patient on the suction. I will attach this here and I will check the suction with the sterile saline. And then I will start the procedure with the patient and I will remove the O2 collar and start suctioning. Before I do that, I will I will hyperventilate the patient with 3 to 6 breaths with the ambo bag. Okay. 4 for good measure. And then I will start the suctioning process. So I will dip it in the saline, double check the suctioning, and then I will insert the catheter without touching the outside of the trach into the trach until I feel resistance. And then I will suction on the way out, swirling. I will clear it with the saline and complete this 3 times until I feel resistance. One more time. Okay, I will clean this out. Then I will secure the suction catheter in my sterile hand so that it doesn't get dirty while I'm assessing the patient. I will, while I'm figuring all this out, I'll give them some more O2 so that he can be breathing while I'm taking care of this. But I will assess the patient's lung sounds to make sure that we're all clear. I will also encourage coughing so that if there's any mucus stuck in there that it can come up. Right now I don't hear anything, but if I did, I would continue to suction 3 more passes, 2 more times. Before I finish with the suctioning, I will ambo bag the patient to just make sure that this is clear. The trach is clear. 3 to 6 times. And then I will perform oral care on the patient. I will suction here, and then I will put the suction in their mouth and make sure that there's no mucus, because from the process of the trach could uproot some mucus into the mouth. And then I will perform oral care on the patient if necessary. Then I will remove the catheter, keeping it in my sterile hand. And as I'm doing that, I will remove the inner cannula and the gauze from the patient's previous so that I can replace it. Balling this all up into my hand and discarding it into the trash. Now I will get the trach care out. I will perform hand hygiene, replacing the O2, perform hand hygiene. I will don clean gloves while I open the trach care. Removing this little sheet because I don't really need it. I will fill that section with sterile saline and place in my cotton swabs so that I can clean the patient's tray, the plate on the trach. Then I will remove these gloves and perform hand hygiene and don sterile gloves. All while I'm completing this whole process, I'm just assessing the patient, making sure that they're okay. They haven't told me that they are feeling any pain, so I'm going to continue with the procedure. I'm checking their O2. Okay, then I will again keep a sterile and a clean hand. I will remove the O2 from the patient and I will replace my collar in here. Sterile hand and a clean hand, and I'm going to replace the cannula. We'll pretend that it is in a package, and I will use my sterile hand to replace the cannula. I will hold the plate with my clean hand and insert it to the right on a 90-degree angle, and enter and move it, pushing it in, locking it in. And we're good there. So then I will use, I will remove the collar. I no longer need a sterile hand because that was what was sterile. I'll remove the collar for the patient. And then I will clean from the in four quadrants from the stoma all the way out and discard. Discard. I will use a piece of gauze to dry it. And then I will replace the fenestrated gauze underneath here. Ensuring that it's smooth and there's no issues there. And then I will replace the collar for the patient. Ensuring that there's space, about 2 finger space, and the client or the patient can move their neck under the collar. And ensuring that everything looks good. Then I will remove my sterile gloves and I will assess the patient, replacing the O2 collar, making sure that they're feeling okay, clean it up. I will pull up the side rail and lower the bed to the lowest height, and then I will perform hand hygiene and leave the client. Thank you.